My journey to attend U of L and how it impacts my current career as a public health physician, it started when I began a search for medical school. I'm from Atlanta, and I had the opportunity and the privilege to go to the University of Notre Dame in South Bend, Indiana. I wanted to stay, after being in South Bend, I wanted to consider staying in that area if I could not come back to Atlanta. So I looked for schools that were in that section of the country. And in my search, I came upon the University of Louisville. And if I couldn't even be back in Atlanta and be home, the people at U of L made me feel like I was at home. Most of my classmates were from the state of Kentucky, so a Georgia girl was a bit of an outlier, but I really felt at home, both from the faculty that welcomed me in, my peers that welcomed me in, and the school really helped me, find my path that I never thought I would go into. I first came to Louisville with the sole intention of being a pediatrician. Like my childhood pediatrician, Dr. Eleanor Stafford, as a female physician, she really impacted my life. And so my intent was to come to Louisville and study to be a pediatrician, come back to Atlanta, set up shop in that space. And in my time at U of L, two paths really impacted my life to help me move toward my work as a public health physician. The first was the support from Dean Kometz at the time, and a woman by the name of Brenda Fitzpatrick with the Northwest Area AHEP Center. Those two individuals really worked intentionally to try to bring in underrepresented minorities, underrepresented persons to come to the University of Louisville School of Medicine. And they really helped us stay focused on our dreams, even when times were tough, times when the academics were often way over our heads. They really, really supported us. So that would be one. The second support that why I'm eternally grateful to my time at U of L is that the university and the School of Medicine helped support me and find a way for me to find my home in student government at the School of Medicine. I didn't really realize that I had an interest and a passion and a calling for it at the time, but there were two groups, both at the university level, at the American Medical Association student level, and also at the Kentucky Medical Association. Both of those groups, in conjunction with the university, allowed a few of us students, and I was privileged to be one of them, to start to learn more about health advocacy, health policy, how we as medical students could impact government legislation affecting health. And it's from those interactions and that support is where I found my calling to say, there's more to healthcare than just the doctor-patient relationship, that individual piece of it. And that support helped me find my calling to advocate on model state legislation, which then impacts the whole community's health, and then gave me the confidence to run for student offices at the local level, at the national level, and to succeed in that space. And I had the backing of the school and the backing of the Kentucky Medical Association. And to this day, I'm eternally grateful for that. That confidence that was built from U of L as a young student then transferred into medical student positions, residency positions, young physician positions. And while I was a resident, my first year as an intern, as a pediatric intern, one of my attendings came up to me and said, I see you as going into government. I see you in public health. Well, I'd never heard of public health. That wasn't part of my core curriculum at U of L. And he kept looking at me and he says, I see it in you. And as I look back on that time, I suspect what he saw was the training that I had gotten as a U of L School of Medicine student in terms of being a health advocate and learning about health policy. And so that support from the university helped me see my path in public health. I went on to public health school at Johns Hopkins. I was the first student to simultaneously pursue a career in public health while being a being a resident. And so it was that passion and that support to keep going is what helped me learn these skills to impact my now future in working in public health as a public health physician who has spent time in clinical medicine, who has spent time advocating for children, for underrepresented communities, and now has led me to my path now here in Atlanta at the Centers for Disease Control, where I am a public health physician working in health policy on behalf of our whole nation. Well, I mentioned the first one, being that medical school can have a reputation for being a stressful and challenging experience. So sometimes I think the analogy is if you are trying to rough up a diamond, rough up something and it gets polished and gets beautiful. Well, there were some professors that either didn't see the talents and perhaps gifts that I had as a student and didn't see the person behind them. And so they were critical of if I wasn't the top student or the middle student. But I used that energy from those professors to really kind of drive that energy and basically to prove them wrong. And at the same time, I knew because the school had been supportive that I couldn't let just a few individuals deter me from my path. And so I had, again, the support of one of my teachers who was actually one of my, um, I guess he saw me as a patient. It was the former Dean Kenny. He had me as a patient. I had an errant eyelash that used to continually scratch my cornea. And so if you're a medical student and you're studying in your classes, you can't do well if you can't see the materials. So Dr. Kenny was always extremely supportive, very, very patient when I would have to keep coming back and back to him. And he would use that time to help teach me about other parts of medicine and other parts of the career path. And he always kept saying, keep going, keep going. You're really good at this, keep going. And so he was an voice in my head that I said, I can keep going. I might not have made the best grade in pathophysiology, or I might not have made the best grade in anatomy or embryology. But I had this other voice that's saying, keep going, keep going, keep going. And so that was a great memory from my time at U of L. A second memory would be my time in working in summer research with Dr. Jeff Weeman on a summer research project. He, again, saw something in me that says, you're really good with reaching people that maybe not have been reached before. And he had a diabetic foot clinic where he was working on research for different populations, and just watching him be empathetic with patients that either didn't have funds to come or were struggling in their path, teaching them about diabetes, teaching them about their path and their course and their lifestyle, helped me see that you really have to see the empathy behind someone to be the best physician. We all took an oath as physicians to treat everyone and to do no harm, and being appreciative of and understanding that person's social context, he was really good at. And so those were some of the biggest memories of my time at U of L. I am deeply honored to receive this award from the School of Medicine. And here's a few things of what it means to me when I was told of this wonderful opportunity. I have learned in my career path that there are so many examples to merge medicine and policy. And in my path along the way, however, I've been told that people say that's a little different. That's a little irrational. It's you're not focused. You are a physician, and so therefore you are to see people in a singular doctor-patient relationship. What I've seen in this process is that I've been able to use my medical training and my passion for public policy to be not just one person's doctor, but the community's doctor. And receiving this award, the fact that the university can recognize that factor is really, really special to me and gives me the energy to keep going and bringing that future in front of me. When I was a student at U of L, I didn't really see myself as a pioneer or a trailblazer. I was just content to just survive and maintain the classes. But I really now see the importance of being both the messenger as well as improving the message to improve the community's health. To reach people about health, it's really important to improve the social and the economic and the policy conditions for how they receive their health care and what affects their health care. And so having that opportunity and that support by having this award gives me an opportunity to talk more about the great things that the university has done, can do, and what other universities could do to support people in that holistic view of medicine. It's really, really important to have physicians that look like their communities to serve them, but also the training to have the humility to be a servant advocate for not only your individual patients, but the patients of your community. When I was a student at U of L, my classes had a growing number of women students, and I believe now the population of women physicians in this country is almost 50%, which is outstanding. In my class, there were only two Black females. And my late father had a saying that one can't teach what one doesn't know, one can't go where one hasn't been. And so, receiving this award, I'm hopeful that other young women who look like me can then go where I haven't been and go to another place. My best and most important job is to be the mother of a 16-year-old now son. And I constantly impress upon him to go after his dreams. And in order for him to go after his dreams, he needs to be in a situation and be in spaces where he can see himself in that future and not only look forward, if you're driving in a car, look forward in that large windshield, but also pull the behind individuals before you. Um, I'm hopeful that this award can show all students, not just students who look like me, but particularly those students who look like me, that they can consider and excel past their wildest dreams as a physician and to be advocates for the public's health. Black female physicians number approximately only 2% of the physician population, and it's really vitally important that more women physicians who look like me can see their future in healthcare, as studies show that gender and racial concordance do impact health disparities and improve health equity. And I know the university is very been supportive of improving health equity, not only in Louisville, but in the Commonwealth as a whole. Because U of L, particularly the School of Medicine, has been in a history of being intentional about trying to bring underrepresented persons into healthcare. Over 20 years ago, they supported me. They saw something in me to help bring me into my dream as healthcare. And since I've graduated, they have supported other students by creating advisory boards and creating other opportunities for them, which I hope will continue as a result of this award. The U of L School of Medicine brand has also helped me to connect with other students and recent alums. So here down in Atlanta, I ended up recently connecting with a now recent graduate of the university and who was in a combined program of medicine and business, which we didn't have business and medicine back then, but medicine is a business. And to be able to support this young man as a mentor, as a colleague, as he opens his nonprofit Greater Influence to help improve the diversity of underrepresented persons in healthcare, is an awesome opportunity. And as a recipient of this year's award, I'm hopeful that I can use this time to reach other young alums, other young students, to help them accomplish their dreams, whether it be business medicine, business policy, business government, or whatever that is, to increase representation to medicine and be not only this vision for them, but be a mentor to them. I'm hopeful this award will help generate additional scholarship funds for these underrepresented minorities in medicine and bring the next generation of diverse leaders. And for that, I'm truly grateful to be part of the University of Louisville community.